Welcome back, everybody. I'm the Doc Bob Lee from 107.5 WBLS. You are watching Open, and we thank you and appreciate you for it, too. Our next guest is a gastroenterology specialist for the Gastroenterology Associates of Brooklyn, and she's with us today to share some vital information about colorectal cancer and the preventive options that exist for patients. So please welcome to the show, Dr. Cynthia Quainoo. Doctor, welcome.
Thank you. Thank you for having me.
And thank you for all that you're doing in our community to create the awareness that there is a situation, there's a problem, but it can be corrected. Tell us Absolutely. How you got started in this area.
Wow. So yeah, I have a strong natural interest in liver diseases in particular. I did my residency training at UMDNJ in Newark, New Jersey, and they have a liver transplant team. So I got interested in that early on in my career, and hepatology, liver diseases, is associated with gastroenterology, and so that's how I became involved. In terms of my community service work, I've actually been kind of doing this to some degree or another since I was a resident, since I was a student, and I geared most of my energies to raising awareness, particularly in our community, about colon cancer.
Was there somebody in your family or in the community that you took note of that moved you in this particular area?
A patient early on when I was a student. You know, there's a lot of stigma, especially in our community, surrounding colonoscopy. And I encountered a young man who was in his late 30s with rectal bleeding, and he had ignored it for some time and refused to get checked. And it turned out there was colon cancer. And unfortunately, at that point, it had spread. And so it was too late to do anything curative. But that situation struck me, and I noticed that it was a major issue in our community.
And we know a lot. We know of a lot of people who have suffered from it, and some people that went in early. I was at a location. I was doing something on location, promoting this center in Harlem. And the guy came up to me like a year later. He said, "Bob, you know, I was listening to you when you had the speakers outside and you had that microphone and you were talking to people about checking your I just went straight to check your butt, check your,
yes.
Check for cancer, get the screenings necessary that complete your thought if you think that you may be suffering from something." And he says, "I went in and I checked and I had colorectal cancer." And I thank you for creating that awareness. So we thank you for continuing to create that awareness in our community, because people need it, because people don't think that they may have a situation. What are some of the symptoms? Because sometimes you think there's none, but what are some of the symptoms that people can look out for? Right.
So that's a great point. So oftentimes there's no symptoms. I, along with a lot of my colleagues, everyone's had the experience of doing a screening colonoscopy on a patient who had absolutely no symptoms at all, normal blood work, and we find a cancer. So it happens. And those cancers, because they're asymptomatic and no anemia, no low blood counts, they're early stage cancers, and they can be removed, and the cure rate or the survival rate is over 90%. Once you get into the realm of having symptoms, it makes it a little bit complicated, but some of the symptoms include passing blood from your rectum. Okay, so we're kind of at the point where we don't discount that as hemorrhoidal bleeding automatically, right? So about 10, 20 years ago, you probably could get away with saying, you know what, this is probably just due to hemorrhoids. You don't need any further testing. But the incidence of colon cancer in the United States has increased, especially among the young population. So there's patients between the age of 20 and 49 who are now getting colon cancers. So if you have bleeding, get checked, okay? If there's any abdominal pain, go see a specialist. If there's any change in bowel habits, bloating, weight loss, or just overall feeling unwell, these things need to be investigated, and we're not in a situation where we can take it for granted anymore.
Yeah, and so you have to, go get it checked out. Go get a colonoscopy. It could be you have
Absolutely.
a problem down your lower left area. It could be diverticulitis and things of that.
Right, right.
But you need to go in and see what's going on, because it could be a polyp that you can remove and make
Absolutely.
it okay. Um, what do you reckon people should go and get a colonoscopy at what stage of the game, or what age?
What age? So for a long time, there was a difference based on ethnicity or race, excuse me. So Black people and African American people in the United States are considered a high risk group for colon cancer. Black men specifically develop early age advanced cancers, and they die more as compared to any other group. The reasons for that are multifactorial: access to healthcare, education, and some genetics, lifestyle, and other risk factors. So it's been 45 years old for Black and African American people for a long time, except it was poorly publicized. So for non-Black population, it was age 50. Okay.
Yeah.
October of last year, because of the recent data I just quoted you, for the new cancers in young people, they decreased the screening age to 45 years old. So if you're a 45-year-old person with no family history and no symptoms, you're eligible to get colon cancer screening with a colonoscopy and other methods that we can discuss.
Doctor, what are some of the things that we can do to prevent colon cancer? Diet, exercise,
Sure.
the movement in the body. What?
Absolutely. So diet is very important. Diets that are high in meat and high in processed meat specifically increase your risk for colon cancer. So we're talking about, all the good stuff, the sausage, the bacon,
Uh,
the luncheon meat. It's a problem.
uh,
In order to decrease your risk, you have to take in more fiber, more fruits and vegetables, insoluble fiber.
yeah.
Tobacco use, of course, is linked to almost every cancer, and that includes colon cancer.
Even if you
Exercise.
smokes, that the secondhand smoke too.
So absolutely, yes. Secondhand smoke too. Exercise, of course, is important as well. Staying slim, because obesity is a risk factor. Insulin resistance, diabetes is a risk factor as well.
Yeah, yeah. And I know of a number of people, and in our families, we can call out some people who are having trouble in that area, and then we
Right,
know people who passed away.
right.
A
So
lot of R&B artists, or rappers, people in the music
sure.
who go around and they don't have time to sit down and eat because they're running so hard.
Right, absolutely. I think you touched upon family history for a second there.
Yeah,
In our community, it's kind of taboo to discuss the C word, cancer, right? So if those type of things are not being discussed among family members, you don't know what your risks are, right? So I encourage. It's nothing to be shameful for being diagnosed with a cancer. It's nothing to be shameful about having any type of illness, but these things need to be shared among family members, because if you have a first degree relative with polyps or colon cancer, you're actually eligible to get screened at an earlier age than 45. It would be 40,
yeah.
if that person was older than 60. So the younger your first degree relative is diagnosed with colon cancer, you have to start your screening 10 years before that person developed their cancer.
And this is Colon Cancer Awareness Month, right? Doctor, thank you for hanging out with us. Thank you for talking. You have your wealth of information. I feel rich. Thank you. Where can we go to get more information from you?
You can contact my assistant. Her name is Lordia, Lordia, and her phone number is 929-409-9148. My personal email is cequainoo@gmail.com. Believe it or not, people use social media to make their appointments with me as well. So you can see me on Instagram at CQ Method, or on Facebook by my full name, Cynthia Quainoo.
Quainoo, Dr. Quainoo, you have telehealth and all of that? They can
Absolutely.
this and you can, beautiful. Thank you
Absolutely.
so much. You got to come back again and share more, okay?
Absolutely.
Thank you.
Thank you for having me.
Thank you. Dr. Cynthia Quainoo, MD, Gastroenterologist Specialist. Thank you. We appreciate you. We'll take a break. More open on the way. Don't move.